If you're about to be starting intern year, or even if you're a medical student doing clinicals, this video is for you. I am going to tell you, after just finishing my intern year of residency, 4 key takeaways on how you can do well working either as an intern or on your clinical rotations, even if you're not super confident in your overall medical knowledge. Now, as I record this, it's the end of June, which means that there's about to be a whole set of new interns. I'm glad I am now not one of them, although I'm now going into my specialty, PM&R, so I'm starting back at the bottom of the totem pole there. But if you are a medical student who's about to start 3rd or 4th year rotations, maybe you're sub-Is, or you're going to be an intern, then this video is hopefully going to help you. So the first thing, and you may already know this one, that you can do is befriend the nurses. The nurses are the backbone of the hospital, and they can make or break your life in terms of how smoothly a rotation goes or how difficult it goes. So you do not want to get on the nurse's bad side. Do not think because you're now a doctor that you know more than these nurses, because a lot of times, especially in certain areas, you definitely do not. Also, if you're a new resident and let's say you tell them to put in a certain order and they have questions about it, or they want to ask your senior resident or attending, don't take it personally. You're now given a lot of power as a resident going from a medical student, and it could be scary even for the nurses who really care for their patients. They just want to make sure their patients are getting the absolute best care. So don't take anything personally. Be friendly with the nurses, respect them, and it's going to go well for you. Okay, number 2 is just to be professional in general. A lot of intern year and getting through, this is kind of in life in general, jobs in the corporate world, even in medicine this applies, is if you can be professional, it really goes a long way. So that means showing up on time, knowing how to appropriately speak to colleagues as well as the patients. You're, in a sense, sometimes in the customer service business. Sometimes patients are going to get mad at you. They're going to scream at you. I can't tell you the number of times I was cursed out last year. You got to keep a smile on your face the best you can and just be professional at all times. You're in a position of power as a physician, and you want to really treat that responsibility with a lot of respect. And number 3 is just keeping a positive attitude at all times. Maybe you don't know everything about the medicine yet. You're not expected to as an intern. But what people will remember about you is how you made them feel when you walk into that room. If you walk into that room and it feels like, oh no, I'm about to be stressed, I'm about to be bombarded with a million questions, that's not generally the vibe you want to give off or what you want to be known for. But if you come in, you're positive, of course, ask questions when appropriate and work on improving yourself every day. But if you could be social, you're someone that people want to be around at work, that goes a long way. And number 4, even if you don't know everything you need in terms of medical knowledge, the one thing you can know is your patients, and that's very important. So if you're an intern, you're probably carrying somewhere between 8 to 10 patients a day. If you're on the floors, you need to know your patients. Now, it can be challenging at first, but what I recommend is putting in the work ahead of time. So when you first get that handoff or you first pick up a new patient, really reading through any past notes, the full admissions note, pay attention during the handoff, speak to family members of the patient. That really helps as well if possible. And if you know your patients and you're doing rounds and people ask, oh, did this patient ever have a history of COPD? And you can answer that right away, even if you don't know, every mechanism and every treatment guideline. If you know your patients, that will go a long way, whether you're a 3rd year medical student on a sub-I or an intern. So those are 4 things that, even if you don't have the most medical knowledge, will help you do very well as an intern or starting clinicals.